So if you've been prescribed medication like Redsun, Viagra, Comit, and you want to know how to get the best results from this medication, this video is for you. I'll cover everything that you need to do and not to do in order to get the most out of this drug. Comit, Redsun, Viagra, these are brand names for the medication sildenafil, which is prescribed by a doctor to help men who struggle to get erection and also keep an erection. I remember a patient once told me that the medication didn't work for him. When I asked him when he took the medication, I had the usual answer, right before sex. It wasn't surprising at all. You see, Redsun, Comit, Viagra, sildenafil, this medication takes at least 30 to 60 minutes to properly kick in. So tip 1, don't rush it. Take the medication and allow it a bit of time to do its job. Tip 2, try to take it on an empty stomach. When you eat heavy meals like oily and fatty meals, they slow the absorption of the medication. So here is a free tip. If you've already eaten, wait around 2 hours and take the medication to get much better results. Number 3, you want the medication to help you, but you don't want to help the medication. It's not magic. You can't just take the medication and go and sleep or go and do something else. No. You have to be aroused or stimulated. That's the help that you give the medication to keep you erected for its window period. Finally, let me educate you on some of the side effects of sildenafil. Most patients will have the mild effects, which are headache, facial flushing, GI discomfort, and sometimes visual changes. One serious side effect that you should be aware of as well. Usually, your healthcare provider will educate you on some of these serious side effects. One is having longer erection than expected, chest pain, and third one is hearing impairment. If you experience some of these changes, please seek an urgent medical advice. I believe you love this information. If you know anyone who will benefit from this information, please do well to share to them. And don't forget to subscribe. Dr. Leon, I'm out.